together.
Researchers at the University of Washington and Moscow State University are teaming together to develop a new technology. Their focal therapy for prostate tumors is based on non-invasive ultrasound-guided mechanical disintegration of tissue. Moscow State University is renowned for expertise in nonlinear wave phenomena and modeling, and designing high-intensity focused ultrasound transducers. The UW team members are experts in designing therapeutic ultrasound devices, conducting transitional experiments, and evaluating the bioeffects of HIFU. This research is supported by a unique joint funding opportunity from the National Institutes of Health in the United States and the Russian Foundation for Basic Research.
Since the FDA approval of thermal HIFU about 5 years ago now, there's been dramatic uptake clinically in using the technology for treatment of patients with the goal of minimizing side effects of prostate cancer treatments while delivering the same treatment benefits of more traditional approaches. Early experiences, while promising, have shown that there's clearly a way to potentially improve the technology, and our vision is that we can do that with some of our techniques. In particular, thermal HIFU has challenges as far as monitoring in real time. The second is that because it relies on thermal mechanisms, that allows for potentially thermal diffusion of heat, which could increase the risk of side effects like leakage of urine and sexual dysfunction. And also related to that, early series has suggested that there's the risk of positive biopsy after treatment up to 30% of patients. And as a result, we think we can potentially improve the rate of cell kill as well with our techniques.
Our team is developing a technology. We termed it boiling histotripsy or BH technology, and the aim is to mechanically liquefy tissue rather than thermally ablate it at the focus. We use millisecond-long pulses with very high amplitude that are focused, and while propagating from the transducer to the focus, initially harmonic waves transform to the shock wave at the focus. And these shock waves, they heat tissue into very high temperatures within each pulse. Then a vapor bubble forms, and interaction of shock waves with this bubble results in tissue disintegration to subcellular debris through the mechanism of atomization and acoustic fountain.
In this illustration, you can see the relevant pelvic anatomy, particularly the relationship of the bladder to the prostate as well as the rectum behind the prostate, allowing for a good acoustic window from through the rectal wall into the prostate. In this illustration, you can see that we've placed the probe into the rectum and have the probe in alignment with the prostate to facilitate treatment. And then in this illustration, you can see we've turned on the ultrasound probe with the delivery of the acoustic waves into the prostate. At the focal point, you can see the appearance of hyperechoic bubbles on ultrasound, providing real-time feedback for where we're treating. And then as treatment evolves, you can see that these hyperechoic bubbles are replaced by dark hypoechoic bubbles, indicating that we've successfully treated the target.
One of the important problems in this project was to build the probe itself. It's a core of the project. And mathematically, this is a multi-parameter problem. It involves optimization of dimensions, focal distance, frequency, power, and so on. After the probe was designed, it was built for us by Imasonic. And what is important, the probe should operate in the way we want. And to check that, we needed to characterize it. And we did that by placing this probe in a water tank and by using a technique which we developed previously, which is called acoustic holography. We found the boundary condition, and then we used this boundary condition to run nonlinear equations which predicted nonlinear field created by this probe. We made sure that BH conditions indeed were achieved.
So in order to treat clinically relevant volumes with BH, we had to come up with a system to position our focus in three-dimensional space. For that, we put together the system that you see here. It includes the probe, which is the therapy probe, and the imaging probe in the middle. It has the coupling balloon that is inflated with water, and it can change the position of the focus in tissue by inflating or deflating this water standoff. A 3D positioning system can position the focus with sub-millimeter precision in the axial direction and in the angular direction. In preparation for our preclinical experiments, We performed a number of ex vivo studies with prostate tissue. We embedded it in gel phantom and at first put it in the water tank and performed BH exposures of the tissue through the water. As well, we performed more realistic scenario of coupling to the phantom medium through the balloon, like it will be in the clinical experiment, and it was successful as well.
One of the big benefits of BH is the ability to monitor the treatment in real time with B-mode ultrasound. And in particular, it provides the opportunity to get feedback on both treatment targeting as well as treatment efficacy or treatment completion.
Using the system developed at the University of Washington for prostate treatment, we performed several preclinical feasibility studies using ex vivo prostate tissue. The tissue was processed for histological and ultrastructural analysis, so transmission electron microscopy. The histological evaluation, you can see from this figure here, the lower part is the lesion and there is homogenized tissue, and so there is a lack of cellular structure, and above that you can see non-treated normal cellular tissue with structure. If we look closely at the lesion contents at the ultrastructural level, we can see that the cells were completely homogenized and there is loss of structure at the ultrastructural level, and there are no organelles present.
To date, we built a preclinical device for transrectal BH prostate ablation. And using this device, we performed initial feasibility studies using ex vivo fresh tissue, as well as initial first in vivo treatments delivering BH to the prostate transrectally, targeting both malignant as well as benign tissue. In the future, we plan to build a clinical prototype device in which we would characterize that and its ability to effectively treat the prostate using both ex vivo and in vivo experiments, with the ultimate goal of performing first-in-human experiments and trials in the next few years.